Understanding Medicare, a comprehensive guide to its four main parts on navigating the complexities of Medicare, is crucial for individuals approaching eligibility, as a thorough understanding of its structure can prevent significant enrollment errors and ensure appropriate healthcare coverage. Medicare, a federal health insurance program primarily for people aged 65 or older, certain younger people with disabilities, and people with end-stage renal disease (ESRD), is often perceived as confusing due to its multi-part structure. This guide aims to demystify Medicare by breaking down its four core components, parts A, B, C, and D, providing a solid foundation for informed decision-making regarding healthcare coverage. Understanding these distinctions is paramount for anyone transitioning onto Medicare, whether due to age, retirement, or disability. The goal is to simplify this often overwhelming subject, empowering individuals to make confident choices about their health insurance. Original Medicare. Parts A and B. Original Medicare forms the bedrock of the Medicare system, comprising Parts A and B, which have been in existence since Medicare's inception. These two parts provide essential coverage for hospital and medical services directly through the government. Grasping the scope and limitations of Parts A and B is fundamental before exploring other Medicare options. Medicare Part A. Hospital insurance. Medicare Part A serves as your hospital insurance, primarily covering inpatient care. This crucial component of Original Medicare is designed to alleviate the financial burden associated with significant medical events requiring hospitalization or skilled nursing care. Part A covered services. Part A encompasses a range of critical services, including inpatient hospital stays and coverage for care received when formally admitted to a hospital. Support term care in a skilled nursing facility after a qualifying hospital stay, focusing on rehabilitation or recovery. Support and comfort care for individuals with a terminal illness. Home health care. Limited, medically necessary services provided at home, such as skilled nursing care or physical therapy. For the vast majority of beneficiaries, Medicare Part A is premium-free. This applies to individuals who have worked and paid Medicare taxes in the United States for at least 10 years or 40 quarters. Spouses who meet this criterion also enable their partners to qualify for premium-free Part A. This premium-free status is a significant benefit, making essential hospital coverage accessible to millions. Important exclusions. It is vital to recognize what Part A does not cover. Specifically, it does not cover long-term care, which includes custodial care in nursing homes. Custodial care, defined as non-medical care that helps with daily living activities like bathing, dressing, or eating, is generally not covered by Medicare Part A, highlighting a critical gap that often requires separate planning. Cost-sharing responsibilities. While premium-free for most, Part A is not without out-of-pocket costs. Beneficiaries are responsible for deductibles and co-insurance amounts. For instance, in 2025, the Medicare Part A deductible is set at $632 per first 60-day benefit period. This means that for each new benefit period, which begins the day you are admitted as an inpatient in a hospital or skilled nursing facility and ends after you have been out of a hospital or SNF for 60 days in a row, you may be responsible for this deductible before Medicare begins to pay its share. Understanding these cost-sharing mechanisms is essential for financial planning. Medicare Part B. Medical insurance. Medicare Part B is your medical or doctor coverage, extending beyond hospital stays to cover a wide array of outpatient services and supplies. This part is critical for routine healthcare, preventative services, and managing chronic conditions. Uninsured services, Part B covers a comprehensive list of services, including doctor's office visits, consultations with physicians and specialists, charges for physicians' fees, charges for medical services provided by doctors, even during inpatient stays, services, diagnostic testing services like X-rays, lab tests, and MRI scans, ambulance services, emergency transportation to a hospital or skilled nursing facility, preventative services, screenings, vaccinations like the flu shot, and counseling to prevent illness or detect it early. Durable medical equipment, DME%, items such as wheelchairs, walkers, and oxygen equipment. And non-self-administered medications pertinent, certain medications administered by a healthcare professional, typically in a clinical setting. Medicare Part B is a not premium-free plan. This often comes as a surprise to new beneficiaries. In 2025, the standard Part B premium is $185 per month. However, this amount can be higher for individuals with higher incomes, subject to income-related monthly adjustment amounts (IRMA). This premium is typically deducted directly from Social Security benefits. Part B cost-sharing responsibilities. Part B also has its own deductible and coinsurance. In 2025, the Part B deductible is $257 per calendar year. Once this annual deductible is met, Medicare Part B generally pays 80% of the Medicare-approved amount for covered medical services, leaving the beneficiary responsible for the remaining 20% coinsurance. This 20% can accumulate significantly, especially for individuals with chronic conditions or frequent medical needs, underscoring the value of supplemental coverage. Become eligible for Original Medicare Parts A and B on the first day of the month they turn 65. However, certain individuals under 65 with specific disabilities or end-stage renal disease (ESRD) may also qualify. The initial enrollment period (IEP) is a critical 7-month window during which most people should enroll to avoid penalties. This period begins 3 months before the month you turn 65, includes your 65th birth month, and extends 3 months after your 65th birth month. It is possible to delay Medicare enrollment without penalty under specific circumstances. If you are still actively working at age 65 and have health insurance through an employer with 20 or more employees, you can postpone enrollment. Upon retirement or loss of employer coverage, you qualify for a special enrollment period, typically allowing up to 8 months to enroll in Medicare without incurring late enrollment penalties. This flexibility is crucial for those who choose to work past 65. Advantage offers an alternative way for beneficiaries to receive their Original Medicare Parts A and B benefits. These plans are managed care options provided by private insurance companies that contract with the Centers for Medicare and Medicaid Services (CMS). Medicare Advantage plans represent a significant departure from the traditional fee-for-service model of Original Medicare. To enroll in a Medicare Advantage plan, you must first be enrolled in both Medicare Part A and Part B. Crucially, you must also continue to pay your Medicare Part B premium, even if your Medicare Advantage plan has a $0 monthly premium. These plans essentially take over the administration of your Medicare benefits, providing all the services covered by Original Medicare. Coverage and cost-sharing patents. Medicare Advantage plans are legally required to cover all the same services as Original Medicare Parts A and B. However, they are allowed to set their own unique cost-sharing requirements, including deductibles, co-payments, and co-insurance amounts for various services. This means your out-of-pocket costs for specific services may differ from those under original Medicare. Work-based care (TARE), a defining characteristic of Medicare and Medicare Advantage plans, particularly HMO, Health Maintenance Organization, and PPO, Preferred Provider Organization models, is their reliance on a network of doctors, providers, and hospitals. Beneficiaries typically need to use providers within the plan's network to receive the highest level of coverage, and in some cases, any coverage at all, especially with HMOs. This network restriction is a key difference from original Medicare, which generally allows you to see any doctor or hospital that accepts Medicare. Additional benefits and premiums. Many Medicare Advantage plans offer attractive additional benefits not covered by original Medicare, such as SETED, dental coverage and routine cleanings, x-rays, and sometimes more extensive dental work, hearing vision coverage, eye exams, and allowances for glasses or contact lenses. Entering benefits, hearing exams and discounts or allowances for hearing aids. Artist programs and memberships to gyms or wellness programs. And over-the-counter OTC allowances for credits for purchasing health-related items. Many Medicare Advantage plans also integrate prescription drug coverage Part D directly into the plan, simplifying coverage for beneficiaries. Furthermore, many of these plans are available with a $0 monthly premium bed in many areas, making them an appealing option for budget-conscious individuals, though the Part B premium still applies. Medicare Part D. Prescription drug coverage. Medicare Part D is dedicated to covering your own prescription medications, specifically those you typically pick up at a pharmacy. This part of Medicare addresses a significant gap in original Medicare, which does not generally cover outpatient prescription drugs. Part D plans are exclusively offered by private insurance companies approved by the federal government. Beneficiaries can obtain Part D benefits in one of two ways: an ME standalone Medicare Part D drug plan. For those with original Medicare Parts A and B, a separate Part D plan can be purchased to cover prescription drugs. Medicare Advantage Plan, MEPD. Many Medicare Advantage plans include prescription drug coverage rolled directly into the plan, offering a single, integrated solution for health and drug coverage. Part 10 variation in coverage. Part D plans can vary significantly in terms of which medications they cover, their formulary, and how much you will pay for those covered medications, co-payments, co-insurance, deductibles. However, even the most basic Part D plans are mandated to cover most generic and brand-name medications and must cover all or most drugs within certain protected classes, such as anti-cancer drugs, antidepressants, psychotics, anticonvulsants, immunosuppressants, and HIV/AIDS drugs. Part D plans, vaccines, like the shingle shot, which are not covered under Medicare Part B. Enrollment penalty. A critical aspect of Part D is the late enrollment penalty. If you delay enrolling in a Medicare Part D plan when you are first eligible and do not have other accreditable prescription drug coverage that is considered at least as good as Medicare's standard Part D coverage, you could face a lifelong penalty. This penalty is added to your monthly Part D premium for as long as you have Part D coverage. This rule encourages individuals to enroll in a Part D plan, even an inexpensive one, even if they take few or no medications, to avoid future financial penalties. Choosing your Medicare path. When becoming eligible for Medicare, you will encounter a plethora of information and advertisements for various plans. These plans generally fall into one of two primary categories: the Medicare supplement plans, also known as Medigap plans that work in conjunction with Original Medicare or Medicare Advantage plans. Part C. Each option presents distinct advantages and disadvantages, and the optimal choice is highly individualized, depending on factors such as your health status, financial situation, preferred doctors, and travel habits. Medicare Supplement Plans, Medigap. These plans are designed to work with Original Medicare Parts A and B to help cover some of the out-of-pocket costs, such as deductibles, co-payments, and co-insurance that Original Medicare does not cover. Medigap plans allow you to see any doctor or hospital nationwide that accepts Medicare, and they do not have provider networks. However, they do not include prescription drug coverage, so you would need a separate Part D plan. Medicare Advantage plans Part C present. As discussed, these plans replace Original Medicare and offer an all-in-one solution, often including prescription drug coverage and additional benefits. They typically have lower monthly premiums, often $0, but usually involve network restrictions and co-payments for services. Making an informed decision requires careful consideration of these options. Consulting with a licensed independent Medicare insurance broker is highly recommended. A knowledgeable broker can provide unbiased guidance, review all available plans and pricing in your specific area, and help you compare the pros and cons of Medicare Supplement versus Medicare Advantage plans based on your unique needs and preferences. Their expertise can simplify the decision-making process, ensuring you select the most suitable and cost-effective coverage. In summary, Medicare is structured into 4 main parts: Original Medicare Parts A and B providing hospital and medical coverage, Medicare Part C Advantage, offering an alternative, often comprehensive private plan, and Medicare Part D for prescription drug coverage. Understanding the nuances of each part, including eligibility, costs, and enrollment periods, is essential for securing appropriate health care and avoiding penalties.
If you want to learn more about Medicare, subscribe to my channel for all the latest updates and tips.